Okay, everyone, take one more minute to wrap up, and then we'll get started in hearing from each of the groups. Tables in the back. Dr. Kington, I'm just saying. Okay, I'm very, very curious about how you all thought to address this question. Please, as we go around, identify yourselves as usual. If you did pick any particular group of kids or any particular geographic region or any particular anything, mental or physical health outcomes, let's hear that too, so we have context for what you've come up with. Who would like to go first? There you go.
So we had a group of 3 that grew to 4. So you told us 2, we got 4. But we have a couple topics that came up, but I think there's some potentially interrelationship between them. One is looking at trauma, not only the trauma that our communities have historically experienced and are currently experiencing, but also the role of institutions in perpetuating that trauma. And then, as we were talking about institutions, then thinking about anchor institutions and what are the opportunities there for them to leverage that role in community and improve the community, and also the challenges of community engagement.
Wonderful. Anchor institutions as a solution, as an opportunity, as a trend. Who's next? Oh, good. Back there, that table. Not that anyone raised their hands, but, you know.
We were just getting going, Dwayne. And
So we just got started. Hi, my name is Jennifer Ware. I'm the Health Equity Coordinator with George Washington Cancer Center. And we just started talking about, we were getting in our groove. So we were talking about sort of so we started talking about healthy environments, built environment, physical activity, access to learning and reading materials, and then it was, how can we get all of that? How can we have all of it together? And I shared that in Oregon, in Southern Oregon, I coordinated a cross-sector collaborative health equity coalition that we basically pooled our resources. We were a collective impact organization with law enforcement, public health, community members, community-based organizations, K-12 education and higher ed, and many other groups all together working for health equity. And it was by pooling resources that we were able to implement change, implement policy, and see health improve.
So pooling resources and using a collective impact model to get to change is good. All right, thank you. Coming to the middle. Right, this one, right here, you all.
Hi, I'm Charlie Alexander. I'm with the National Academy of Medicine. So at our table, we talked about birthing centers and how catching parents early helps to promote both their physical health and the health of their child, as well as provide social support, which improves child outcomes. And we also talked about early education centers and making sure that parents support the practices that are going on in the classroom, and to create strategies that take into account the child's ecology. So really just parental involvement from the get-go. Parental
involvement as community people, as equals sitting at the table with others. I'm going to read from a poll everywhere before I go to this table back here. The greatest opportunities present themselves in the early years and early stages. It's all about prevention and early intervention. Children and their families need access to healthcare professionals without risk of losing coverage or being displaced when they most need care. Parents need access to training programs and supports that scaffold them through the developmental phases as their children grow without barriers related to cost. If we kick the can down the road, as we are so good at doing, we lose time, we lose money, we lose lives. Thank you for that online contribution. And so coming to this table here, any dyad, triad that wants to go, feel free.
Media with young people, and since we had a young person with us, so we're experts on this issue. But I think two or three things came up. One is that social media is not really a community in the way we normally think of it, and to be cautious, therefore, about it. On the other hand, maybe simple information going via social media can be very effective nudges, and some of the encouraging young mothers to get prenatal care and so forth. There's some experience in that. And then also kind of hearkening back to the discussion about barbershops, when you start connecting social media to an institution, a body that young people are comfortable with, familiar with, and trust, that may be the right combination, or it may be a good combination to get the kind of information both up and down that could be very effective.
Nice. So what we heard here was that there's such a thing as expertise by osmosis. All you need is one younger person at the table in order to get there. Okay. That social media can be very helpful in galvanizing change. When the report was released a week ago, I think we ended up with 1.2 million media impressions just by using social media and having a social media strategy to go along with that. And it looked like you wanted to say something too.
Still the same triad, but I just wanted to jump on the parental.
Sure. Identify
participation.
yourself, please.
Oh, yes. This is Chinonye Unwunli with the Office of the National Coordinator for Health Information Technology. At some point, an adolescent is no longer going to trust their parent. We're talking about trust. It was a long time ago that I was a teenager, a very, very long time. Very long time. Okay, just kidding. Yesterday. So we wanted to talk about looking at who they trust. And we talked about engaging perhaps your sports coaches or your guidance counselors as perhaps a messenger, or providing them that sort of health information or health education level to be able to translate or convey information to them or disseminate it.
So leverage trust, build trust, but go to trusted leaders who are already established in these communities, who are already working with others and working with them to move forward. Sound good? By the way, Head Start graduate from the Ward 8 in Washington, D.C. So thank you for being there. I want to let you know it's very important. Let's see, who is next? This table here? Okay.
All right, great. I'm Callie Crumpos with Ready Nation, representing great discussion here. So we had some initial ideas, like using sources in schools, like the PTA and school nurses. And then we got into a larger discussion about really using data, that we can look at data in different ways. So Rob had mentioned things like looking deeper into Medicaid data, and then looking at how we can use that data to move policy. So for example, talking about pay for success models and how that has really been successful, for example, in Utah with the Salt Lake pre-K, and using data to really move policy in a way that can build a culture of health, where there is evidence and a return on investment for investing in good policies.
Very good, very good. So data, that's what we heard towards the end, using it differently, and then leveraging vehicles already available in schools, PTAs, school nurses, and others to help get them engaged in this work going forward. Okay, who wants to be next? I don't have to just randomly pick someone. Okay, good. This is where I was going. Now, this is yours. You got it.
So I hope I'm pushing the right button. Valerie Mahomes, NICHD. We touched on a lot of things that were already mentioned, so I won't say that. But we did talk about this focus on resilience and assets. People are overcoming tremendous amounts of adversity, and they still push forward. They still have a drive to be successful, however they define success. So this movement toward looking at more asset-based and strengths-based approaches, capitalizing on what people bring to the table, I think is a great way to promote child and adolescent development.
So building on the assets that are already present in our communities across the country, and also looking at them not only as asset-based communities, but that if they're still there, they're resilient. And so, and how do we tap into that resilience and bring that resilience up into the discussions and leverage off the power that's already there in communities? Fantastic. Now, were you all one big group? All right, dyad number 2, triad.
I'm Adam Booth, and I'm too close to the microphone. One element of our discussion involved considering technology and ensuring that access to technology was to use it as an agent for hope and opportunity to the outside world in rural communities, and also to ideas that could come into rural communities, rather than seeing and using technology as a drug.
Wow, so leveraging technology in positive ways. And was that it?
Yes.
Okay, good. I just want to make certain I got the whole thing. So leverage technology differently, and I think the conversation we had this morning about health information technologies is a start to get there. I think what we've heard on social media as well ties into that. Was this table one big group back here? Okay, very good. This table one big group? Was this table one large group? Okay, who's going to speak for the other group?
Hi, I'm shy to say, because actually there's a theme or a few themes that have already emerged, and our discussion was very much in line with those things. So really, really finding ways to support education, and then even moving back to early childhood education, you know, child maternal health, and supporting parents, not just influencing them, but really supporting them in different kinds of ways. So everybody talks about parenting skills. There are actually few parents that think that they need to have parenting skills. Well, I remember thinking that I needed a manual along the way, but you know, so again, sort of using the informal networks as a way to really make it a safe place to talk about the kind of support that parents need.
Very good. Using informal networks to talk about supports that parents and others in community needs, addressing those in your conversations as you're trying to pull people together as equals around the table. Hearing from them specifically about what they need in a safe environment could be very helpful to making progress and moving forward. All good? What about this table? One big group? Haven't spoken? Let's hear it.
I am Anna Rettlam from the American Planning Association, and I had Jennifer White from the American Heart Association and Eileen Gale from the McKinsey Social Initiative. We talked about three things. So one was the new education bill called ESSA, which I'm not super familiar with. I have to...
Early Secondary Education Act?
Correct. Every student succeeds.
Okay, every student succeeds. Okay.
And the potential in that legislation to advance physical education, social and mental health of students that has not been really advanced before, and is replacing No Child Left Behind. So opportunities there. From the built environment perspective, we also talked about trends in adopting safe routes to schools, and so that goes to youth and particularly adolescent mobility and having their own agency to move around, and the safety concerns of moving around on streets, and how that's actually influencing wider policies around safe streets in communities like Vision Zero, which make it safer for everyone, as well as and then we talked about civic engagement and opportunities to leverage schools as centers for civic engagement with families and parents. And that could also be applied through things like shared use agreements of schools, allowing schools to be used outside of school hours, has a lot of opportunity for having wider community dialogues.
Okay, that one got me. There's three answers there, and I think I can recall all three. One was identifying policies that already exist, and seeing where there are great opportunities to leverage and promote health equity in that way. Secondly was to lean on the movement to in the built environment for complete streets, for safe routes to school, so that people and children can be mobile within their own communities. I only have two. What's the third? Civic engagement, using public places as spaces for civic engagement to keep communities engaged and active in their work, right? That one got me. Three. I'm counting on my fingers and I lost one. What was this table? One big table or?
Jeff Hutchinson, and the problem with going near the end is that everyone says everything before you get a chance to say it. But if you want to talk about the intersectionality between technology and social media, we had the discussion about how to use some of that, especially with celebrity influence. That teens and young people are often influenced by each other through social media and by people who they admire. We had a little conversation about Taylor Swift and the backlash from the Women's March from that. And then we also discussed a little bit about safe spaces. So as the internet and telemedicine become available and ubiquitous, it would be nice also to have some form where young people have a safe place to use that technology too.
Very good. So a safe place to use technology, and then leveraging off of celebrity influence with young people. And I would go as far as to say celebrities who may influence different communities as well, and to engage them in this work too. Right? So are there any individuals who haven't had a chance to speak yet who have a comment to make addressing this question here? Oh, okay, please.
Just a minor comment building on the technology.
Identify yourself, please.
Oh, sorry. I'm Laura DiStefano. I am Associate Director of Communications at the National Academy of Medicine. And I just wanted to drill down into the technology comment that was made earlier and talk specifically about the gaming industry and the app industry. So thinking about something like Pokemon Go, that's actually getting kids out and moving. Things like Fitbits, which are kind of becoming like fashion accessories, that kind of thing.
Okay, so leveraging off of gaming technologies, app technologies, and others. Yes, and then yes.
Hi, I'm Lisa Glass-Kornstein from Schwa, and I think there's a tremendous opportunity to increase the participation of corporations in the conversation and find ways that the profit-seeking of corporations is not seen as sort of greed-seeking or evil, but ways that we can use business interests to leverage communities of health and acknowledge that those businesses are members of the community who also have interest in the community of health and serving that, and finding the alignment of the health interests with the business interests.
So finding alignment of health interests with business interests, making certain that business sees themselves as part of the solution along with others. Earlier today, we were talking more about very large corporations, those who may be involved with Ready Nation, those who are on Just Cause's list of 100. But we also need to think about our small businesses in our communities. And it makes me wonder that if you ask someone in Ward 8 what their anchor institutions were, would they say it's the same anchor institutions that we think of as anchor institutions? It may be differently. So allowing community members to also have some say in what might be an anchor for their community. And it might be different in Ward 8, it might be different in Appalachia, it might be different in all the variety of places where we come from. Thank you for your comment. Yes, and then yes. Oh yeah, anybody can talk.
Okay. It's actually something I had planned to say when I was speaking. And I've said this before in this setting. The use, different kinds of relationships with existing research associations, professional associations. As was said earlier, I'm president of the American Educational Research Association, and one of the grant programs that's a part of that association is a program that allows people to get small amounts of money, like $20,000 or something like that, to work directly with a community-based organization in order to address a problem or an issue that that community-based organization thinks is important. And that has yielded perhaps some of the most interesting projects that I've seen. It's been implemented for about 3 years. And ACF, with the fatherhood work, has also used that approach where researchers are working directly with community-based organizations in order to be able to collect information, but have them use it effectively. So there are these other venues that around which collaborations can be built that can advance this cause in an equally interesting way.
Interesting. So fostering cross-sector collaborations by including researchers and professional associations matched up with community-based organizations to see what can come out of that, and even seeding some of the thoughts and ideas that come through. Please.
I'm Ruth Lubick. I'm a nurse midwife and anthropologist, and I'd like to take the conversation back to the individual family and remind people that grandparents are very important in many families, and that real attempts should be made to reach out to the grandparents as well and have them come in and share, especially in the prenatal education.
Very good. So the idea of when we think about intersectionality, also thinking about intergenerational approaches and pulling in all aspects of who makes up a family into that conversation. Thank you. JD?
Yeah, I just want to ditto the concept of the private sector's involvement in creating optimal health for all and culture of health. When I think about a company called Go Noodle, I don't know if any of you have heard of that company. It's a bit of a shameless plug because it's a Tennessee-based company, but they're like in 600,000 elementary schools now, and they've clocked millions, maybe billions of minutes of physical activity in kids. That's just one company, idea of a few people that developed an application, and I've walked into classrooms and watched kids really excitedly moving during a lesson, getting taught while that's happening, and teachers having a lot better experience with classroom management. So, I mean, a whole bunch of good things working together, that didn't come out of my brain or government brain, and if we can have a few thousand innovations like that, and if we can monetize primary prevention, and that's really the key, and then have the research base behind it to show that it works, the private sector will be interested in getting involved. One of the challenges for that company initially was, well, we're not so sure that's going to be that might be a distractor in our education plan. So they had to find teachers that really got that it would not be a distractor, that it would help them meet their metrics, and then word of mouth spread it. It's in every classroom in our state, many other states now. But I think that's a great example of the private sector just doing what they do because it makes sense financially to do that, and they're doing good at the same time.
So I like this because I'm hearing about a matchmaker trend here, okay? Pairing up businesses with education, pairing up community-based organizations with professional associations, and then the idea of finding the mutual interest, the health interest or or whatever the business's interest is, and trying to leverage that and come together around those things. Are there any other comments in the last 45 seconds I have remaining? Please, use your mic. Yep.
I guess I want to go back to what's the heart of that statement, child and adolescent development and their outcomes. In 65, James Comer organized schools and communities around child development. And I think to the extent that all of these ideas that we have proposed here are based on what we know about children and how they develop, and we keep children and adolescents the central focus, understanding that what we do impacts their development along the way, I think any of these ideas can be successful.
Well, wonderful. So I'm hearing one that we love our children, right? No, seriously, do we love our children? Right? And so we would make the effort and take the time to pull together these multi-sector collaborations in order to do well by our children because we love our children, right? Anybody not love our children? Okay, it's unanimous. Kimber, I think my job is done here.